Hello, everybody. Thank you for being here and wanting to learn a little bit more about thyroid and how to address that naturally, as well as autoimmunity. So I'm going to go ahead and share my slides with you. We're going to spend the next 45 minutes together, and we'll go through this. Slide by slide. So imagine, and maybe some of you don't have to imagine, that's probably why you're here, but imagine waking up every morning feeling kind of like a mirror shadow of yourself. Your energy is depleted, your mind is foggy, your body is weighed down by this invisible burden, not to mention the weight you've gained without literally changing a single thing. And again, now envision this not as a temporary setback, but as part of your daily routine, that kind of relentless attack on unnamed, unknown, symptoms that are just stealing your quality of life. And I do know many of you don't have to imagine this is your reality. And maybe you have tried a lot of things. I mean, maybe you've gone to your doctors, you've gotten a diagnosis, you've tried medications, you've done some dietary changes, drinking more water, and you are still suffering. So get this, in the United States alone, an estimated 20 million people suffer from thyroid disorders, with a staggering 60% of those being unaware of their condition. That's over 12 million people and individuals living with debilitating health issues, unaware of what's brewing in their bodies. And up to 60% of those patients are on standard thyroid medications. And a lot of them are still suffering. So they're taking a medication, they're doing what their doctor's telling them, and they still feel like crap. We're going to go through today why that is and what you can do about it. So we really are in a thyroid epidemic, and it demands more attention. It demands us as patients, even saying like, hey, I want something different. I need to understand my body more, and how to not just have conventional approaches only to this thyroid issue, since it's actually failing, a great majority of people. So get this, the truth really is, despite billions being poured into the pharmaceutical research, the epidemic of thyroid dysfunction really rages on. And that's why countless people are wondering, if this is their new normal. So health spending really, and this is crazy, you might want to write this down, but if we look at the spending over the last 5 decades, it's gone from, in 1970, it was at $353 per person in 2021 to $12,914 per person. So we're spending more money really than we ever have, but yet people are sicker than they ever have been before. So if you think about, the United States as a whole, and that's the question I'm asking, are we healthier 10 years ago than we are now? Or, are we getting healthier, or are we getting sicker? And I think the answer to that. So I'm not saying, before we dive in, a couple of things. I'm not saying to stop your meds. I'm not even saying that medications are wrong or not needed. Please hear me when I say medications really have their place. But if that's all you are doing is taking medication, and you're not really treating the root cause of the thyroid dysfunction at all, that root cause is probably not going to stay the same. It's definitely not going to get better, and it's probably going to get worse. So over the next 45 minutes, we're going to explore how this very small but mighty gland works, and what happens when it doesn't, what to do about it. And at the end, we're going to talk about an action step for you to take. So please stick with me until the end. And before we dive in, I want to tell you just a little bit about myself and how I got here and why I do this work. So I do know what it's like to not get the answers you're looking for, because I've been where many of you are right now, where you're looking for answers, you're asking all the right questions, and you're not getting to the bottom of it. So if you look at this picture, this is my family and my children, my husband, and I know that on the outside I looked really healthy, but behind the scenes I was really suffering with so much joint pain. It took my husband helping me walk down the stairs to get to this picture. And it started with mold exposure. So I was exposed to mold, and then started getting small amounts of pain in various joints of my body. And the pain moved from annoying to excruciating to debilitating. And as a natural doctor at the time, I threw everything I knew at it: acupuncture, chiropractic, physical therapy. And eventually Advil and lots of Advil, but nothing was working. So I threw my hands up. I spent an entire summer on and off up at Mayo Clinic in Minnesota. I was tested, poked, prodded, radiated, biopsied up one side and down the other. And finally, I was labeled. And I was labeled or given a diagnosis of seronegative spondyloarthropathy and a prescription for a lifelong ball and chain called immunosuppressant drugs. And I just thought, how could this be? How can this be my reality? I was literally fine running multiple half marathons every year, running a busy practice, taking care of kids, to sitting in a rocking chair crying all the time. So it's when a colleague actually came and said to me, he said, you're doing everything structural that you know how, the chiropractic, the acupuncture, the physical therapy, but what you need is a functional medicine doctor to help you find the root cause. And that's when a light bulb went off, and I hired a functional medicine doctor, and I literally stopped listening to anybody's advice, including my own, and I got better. And I didn't get better overnight. It wasn't in a week, not even a month, but I did it, and I got better without drugs and medication. And as I did, I began to study functional medicine. I was mentored by an incredible doctor, Dr. Josh Shields, and I became certified in functional medicine, eventually starting practicing this, which has ended up being the best thing ever, because now I can help people the same way I was helped. And if you look even at Google, there's not very many people that practice this. Or I mean, if you Google functional medicine, you're not going to find a lot of people that are practicing this. But for those of us that are, I do find that this is a lot of people, what people are looking for, just like I was, because years later, I'm not on meds. I have no joint pain. I'm an active mama, an avid bike rider, a thriving practitioner, and I'm back to living my best life. And you can too. So let's go into what functional medicine is. I think we can all agree that like if you look at things like a lack of exercise, genetics, trauma, poor digestion, nutrient deficiencies, those can eventually like fester long enough that they eventually create a symptom. So that symptom then will get divvied up amongst practitioners, medical specialties. So if you have diabetes, you go to the endocrinologist. If you have chronic fatigue, you maybe see an internal medicine doc. If you've got irritable bowel, you see the GI specialist. If you've got cancer, you see the oncologist, and the list goes on. And then those symptoms are treated with either medication or a procedure of some sort. And I'm not saying there isn't a time and a place for this, but we've got to broaden our horizon, look a little bit deeper into this and go, okay, well, if we're treating simply what's above the surface, we're going to be missing that root cause. And is that root cause going to get better, stay the same, or get worse? Probably not going to get better. And it's probably not going to stay the same. So it's just like an iceberg. If you and I were on a cruise and we were going down or going across the ocean, and excuse me, let me grab Kleenex, and we saw an iceberg, we'd be like, ooh, like there's more to that story. We're not going to just shimmy right up to it and know that, oh, we can just go right by it because what we see is the whole picture. No, we're going to be like, we better look a little deeper into this, because it's not what we saw. It's not what was seen above the surface that took the Titanic down. It was everything that was below the surface. So root cause, symptoms are clues. They're telling your body something. And that's where we want to start to look at these different organ systems of your body and say, okay, where is that, or what organ system is being affected, and how can it affect the other systems? Because if you look at standard different resources, you're going to find that there's 11 or 12 primary organ systems that again are divided up amongst specialties, but your body is an ecosystem. The detoxification system can affect the nervous system. The nervous system can affect the hormonal system. The hormonal system can affect the detoxification system. I mean, it's all connected. So what we need is true health as a multi-systems approach, where we really understand the whole picture, that we're not just dividing your body into separate organ systems, not paying any attention to how they interact. So for today, I'm going to talk to you about these different hormonal systems, or these different systems of the body. And I did break them down into 4. It's just for educational purposes, but just remember as we go through these, and you're going to see some overlap in how these systems work, that again, everything is connected. So let's start to talk about the hormonal system. That's going to be our first system. The adrenal glands are these cute little caps that sit on top of your kidneys. And when the adrenals malfunction, your symptoms can really be broad and vast. They can mimic other systems of the body. So have you ever thought that maybe your blood sugar issues have to do with your adrenal glands, or that you keep catching every single cold and flu that's out there because of your adrenal glands? You can even have anxious energy, heart palpitations, trouble falling asleep or staying asleep. I mean, the list really goes on and on. And if you're somebody that you're like, geez, every night I wake up between 2 and 3, it's consistent. Or I wake up like every couple of hours in the night. Those adrenal glands. They're kind of, I think of them like a light, a light bulb that's starting to go out. It might flicker. The adrenal glands kind of do that in the night, is they kind of like short circuit or malfunction, and can really wreak havoc with your sleep patterns amongst all these other things. So let me show you. I've just got a couple of slides. I promise not to try to make you feel like you're back in school trying to understand these weird charts, but I want to show you something. If you look at the top left, you can see cholesterol. It's a little bit blurry, I apologize. But the top left, cholesterol is actually a building block to all of the hormones in your body. So incredibly important. Cholesterol actually comes down, it makes progesterone, and then progesterone comes down all the way down and makes cortisol, an adrenal hormone. So if you are constantly stressed all the time and you're releasing cortisol, you're going to be stealing from progesterone. So if you've ever heard about somebody that they were so stressed out and they couldn't get pregnant, this is part of the mechanism, or one of the things that can happen is that it can throw your reproductive hormones off. Remember, your body's an ecosystem. Too much cortisol all the time depletes progesterone, and then now you have this imbalance of estrogen and progesterone. And that can further mess with your sleep, your metabolism, your libido, your mood, your motion, and the list goes on and on. And look at this next one. This is looking at tyrosine, like you can see kind of in the middle, tyrosine. And tyrosine is a building block that either goes to the right and it makes thyroid hormone, or it comes down and it creates additional adrenal hormones like norepinephrine or epinephrine. So again, if you're constantly running from the bear, you're constantly stressed out and you're releasing all of these adrenal hormones, you're going to be stealing from your thyroid hormone. So have you ever thought that maybe your problem with your thyroid hormone is actually an adrenal issue? And you don't have to guess, you can test, and we can figure all of this out with proper testing. So talking about the thyroid, it is a small but mighty gland in your neck, and there is a receptor site on every single cell of your body for thyroid hormone. So we're going to talk primarily about hypothyroidism. Hyper happens as well, but it's much more common for hypo. If you do have hyper, reach out to me and let's speak about this directly. But when you're hypothyroid, everything slows down. So you can gain weight all over, you can get cold hands and feet, it can throw off your blood sugar levels as well. You can crave carbohydrates, dry skin, hair loss, and the list goes on and on. So our goal isn't to only treat these symptoms. Our goal is to understand the root cause, because if we get to the root cause and understand where it's coming from, we're going to be able to get it corrected, or at least better manage it where it's at. Does that make sense? So let me show you how this works. Your thyroid is actually controlled by your brain. Your brain is like the manager of the whole body, and it starts in the pituitary gland of the brain. And what that does, the pituitary gland pushes out T4, and I rewind. The pituitary gland pushes out TSH. TSH is thyroid stimulating hormone. It goes to the thyroid, and the thyroid pushes out T4. Now, T4 is completely and totally inactive in the body. It doesn't do anything for your metabolism, your energy levels. I mean, were you aware that the majority of active thyroid hormone is produced outside of the gland? Because that T4 then goes down to the liver, the kidneys, and the gut, and it gets converted to T3. And what T3 does is T3 can go all the way over here to the cell, the tissue, the organ, the gland, the hormone, and create that desired response. So what often can happen when we have thyroid binding globulin, it's a binding globulin that goes up, it's almost like it puts a net over the receptor site. So now the cell is supposed to allow that hormone in, but it's got a net over it. So you can see that in testing. And that's why a lot of people are taking, some sort of thyroid hormone, and they still feel like crap because it's not getting into the cell. And oftentimes it's not being tested to determine if it is getting into the cell. Also, if you are stressed out, that T3 will reverse, and that reverse T3 acts just like T4. It's completely and totally inactive in the body. So what causes thyroid binding globulin to go up? What's the root cause of that? Well, things like estrogen and progesterone imbalance, liver dysfunction because the liver processes all of your hormones. Adrenal hormones can cause that thyroid binding globulin to malfunction or to increase, and then it messes with your ability to absorb the hormone. Now, what are the most common tests that are actually done for your thyroid? Most common is thyroid stimulating hormone. So TSH, that comes from the brain. That's not even what's coming out of the thyroid. And then the second most common to be layered in would be T4. But what if T4 can't get converted? What if it can't get absorbed? Like, do you see how like that's tunnel visioning what's going on with your thyroid versus opening it up and saying, okay, well, what else could be happening here? And the number one thing, then 85% of people that have hypothyroid, meaning that if I was a betting person and you have hypothyroid, I'd bet and I get it 85% of the time that the root cause is autoimmunity. And so autoimmunity is when your immune system is causing malfunction in that organ system. And you can test for this. So if you get your thyroid tested, can you see how TSH is just not enough? Even TSH and T4 is just not enough. We've got to understand the broader picture, because if we're in not one thyroid hormone that you could take actually addresses autoimmunity. And the majority of the thyroid hormone that's given out right now is synthetic T4. So Synthroid, levothyroxine, those are T4. So can you see how you could be taking that? That could be regulating your TSH, but it's not doing anything on a cellular level. Make sense? Okay, let's talk about progesterone and estrogen. As women, we really need a balance between progesterone and estrogen. And when it becomes imbalanced, it can lead to a lot of different things: decreased libido, abnormal cycles, infertility, moodiness, irritability, anger, rage, sleep issues, and anxiety. And that balance can be affected by many different things, such as xenoestrogens, these chemical estrogens. The average woman puts over 200 chemicals on her body every day before she even leaves her home. So you've got to start to look at the products like your lotions, your makeup, your body wash, even the things that you're washing your clothing in, because that can have a chemical mimicker that can wreak havoc with the balance between your estrogen and progesterone. Body fat is not, like, if you look at this is a pound of body fat. This is not actually an inert, like, substance. It's a living, breathing substance. It's got blood vessels that go through it. It creates actually more estrogen. So if you are overweight, you're going to be releasing more estrogen and throwing that estrogen progesterone balance off. Poor detoxification, even birth control, hormone therapies. Remember, if you've got on birth control, it's not regulating you, it's suppressing you. So it's actually causing a suppression in your hormones. That's how it works. That's how it works as far as birth control, but it's not really regulating anything. And we find that people that are on birth control, hormone replacement therapies, they end up with problems with the receptor site on the cell for thyroid hormone, master of energy, master metabolism. Have you ever heard of anybody that got on the birth control and they gained 5 pounds? That's part of the mechanism. So the other thing is when you, high insulin levels can really throw this off as well, because insulin, when you eat a lot of carbohydrates, your body regulates that sugar with insulin. And when your cells can only use so much insulin. So when insulin goes high, it starts to steal from progesterone. And again, you got to have that balance between estrogen and progesterone, or it's really going to wreak havoc in your system. And you can test these things. So this is actually a young girl that her cycles were terrible. She cramped so hard, she would throw up at times. She couldn't go to school. I mean, it was a terrible entry into her world of menstruation. So her mother did what every mother would do, is like looked for answers. I want this to go away. And so they took her in. The OBGYN told her she should get on a birth control pill that maybe would regulate the cramps. That's true, but actually it would regulate the symptoms, but it doesn't regulate the hormones. Does that make sense? So what we did is, her mom's like, I can't put this 13, 14-year-old girl on birth control. And so she brought her into me and said, can you test these hormones? This was the test that we did for her, and it showed massive estrogen dominance. So you can look at, let me see if my cursor shows here. You can look at E1, E2, E3, all along the top there of your page. And those that should be, the carrots should be between the stars. So it should swing somewhere in between there. So you can see E1 is almost all the way to the high end of normal. And then E2 and E3 are radically high. So poor girl, no wonder she wasn't having a very good time every single month. But here's the real issue is that we know that high levels of estrogen can increase risk of things like estrogen dominant cancers if those estrogens are not detoxified. So if you look here, 2-hydroxy, that pathway is protective against those cancers, and 4-hydroxy and 16-hydroxy increase the risk of those cancers. So you can see that her pattern is like she's really going down the wrong pathways. It's not a good pattern to be on, as a young girl. Imagine if we didn't test this and fix it, what her risk factors would potentially look like. So we changed her diet, not because she needed to be perfect, but we couldn't have all those insulin levels. So she needed to balance out her sugar loads. And then we put her on specific products that help to bring the estrogen down and push it through the protective pathway. And her symptoms were corrected in a matter of months. And she didn't have to go on any sort of medication and didn't necessarily need us long term. We fixed it and then taught her what to do to maintain it. So there's a lot of studies like this that are done that we could go through that just show, hey, if you do have too much estrogen, you're going to increase your risk of breast, uterine, ovarian cancer. So a test like this is so important because it's a truly preventive test. And I think every woman needs to have this done at some point in their life and probably every few years. I mean, we're doing pap smears, mammograms. Those are early detection. They're not actually prevention. So our body is really, where does all this, like our world, we haven't seen such a dramatic change in the environment and the lifestyles we have in the last 100 years, since the Industrial Revolution. And your liver is a 4-pound metabolic powerhouse that has to process all of these things, including your stress levels. So we're exposed to more. Even if you have a very clean house, you eat very clean food and so on, the air, we have more toxins in our air. Food really isn't even if it's organic, it's like, how was that processed? So our bodies really, and our liver and our hormones just don't know really what to do. And the liver is where the actual breakdown of food happens. And what it does, you eat and it breaks the food down into usable amino acids and antioxidants. And then it sends those amino acids and the antioxidants out into the body so it can regenerate and repair the muscles, tissues, glands, organs, cells of your body. And it takes the antioxidants to kind of like sweep up or clear out the debris, the waste, toxins, the leftover hormones. And when the liver can't keep up with this, the waste starts to accumulate in the body, and that's called free radicals. And what free radicals do is they age you faster. And you can measure this. So if you are getting a blood test done, please ask them to do a CRP. It tells you what the inflammation levels are in the body. And really a full comprehensive functional panel can tell you what all of these organ systems are doing. Because if you've got problems in your detoxification system, it can cause really weird things like tremors, waking up between 2 and 4 a.m., difficulty concentrating. I had a gal that she was certain she was developing Alzheimer's, and it was just a really bogged down liver. And once we got the liver detoxifying correctly, the brain fog lifted, the memory improved, and she was no longer walking into every room wondering what she had planned or intended to do in that room. So you can test these things. And the gut really is the gateway to the health of the whole body. The gut microbiome is really an ecosystem of organisms, including things like bacteria, yeast, fungi, viruses, protozoa throughout the digestive tract. So your digestive health goes way beyond just symptoms that are stereotypical digestive tract symptoms like bloating, constipation, diarrhea, and so on. Because what we have found is 2/3 of people with digestive issues, 2/3 don't have any stereotypical digestive complaints. So the majority, people tell me all the time, I don't have anything wrong with my gut. I'm like, how do you know? That's where your immune system comes from. That's where the neurotransmitters for your brain come from. That's where the beginning of blood sugar regulation starts. That's where you break your foods down into those usable amino acids. Your gut is the surface area of a tennis court. So incredibly, incredibly important to test what's going on here so that we can really look at the health of the whole body, and starting with the digestive system. So here's what your cells should look like of your gut. They should look like that left-hand side where you see really tight junctions. The cells, I think, the cells are like, this is a cell and this is a cell. They should butt up against each other and kind of like interwove their microvilli. And when we get things like microorganisms that are not supposed to be, they're bad microorganisms, toxins, toxic food, even overly processed gluten, things like that, the cells of the gut can start to get inflamed and even crack or break apart. So what that does is it messes with your ability to absorb your nutrients. So we don't really want you taking a whole bunch of vitamins and minerals and just creating expensive poo and pee. We want them to get to where they're supposed to go. This can trigger autoimmunity. It can cause food intolerances. It can mess with the blood-brain barrier. It can cause systemic inflammation. So the symptoms can be so vast, so broad, so wide that we have to stop playing a game of whack-a-mole. Like every time a symptom comes up, we're like whack, and then another symptom comes up and we're like whack. And that's treating things simply only with medications or procedures. They do have their time and their place. Of course they do. But at the same time, we have to say, okay, wait a minute. If you have brain fog, where is that coming from? If you have rosacea, if you have autoimmunity, if you have a bloated stomach, if you've got a headache, let's figure out the root cause of that, even if we do need to treat those things with some sort of symptomatic relief. So as we wrap up here, I want to go through just a couple of patient examples for you and talk about some more kind of what we do with these cases like this. So this was Pam, and she came, the two that I'm going to show you actually looked very similar as far as what they had going on, the symptoms they were experiencing, and they just took different paths. So this is somebody that she came in with digestive problems, anxiety, weight gain, problems sleeping, low energy, and she had been to so many doctors. I mean, I think it takes an average of 6 to 10 doctors just to get a diagnosis of autoimmunity, and she felt wrung out with them and tired of it. And the only reason she came and chatted with me is we have a no obligation, no risk opportunity to talk to a practitioner here in the office to determine if this is a good fit for you and we feel like we can help you or we need to refer you out. But we always provide a game plan. So there's no risk to her coming in at all. And so we talked about the difference in testing and how we could look a little bit broader and wider as to what was going on. She agreed to the testing, and we found autoimmunity, we found inflammation, a hormone imbalance, candida. She was the little engine that was like running on fumes. No wonder she didn't feel good. So she decided to do a 4-month program of care. Our initial intensive care programs are 4 to 6 months. And after care, this is what she said. She said, I'm happy again. Like no more digestive issues, no brain fog, no forgetfulness, no sugar cravings, no more anxiety, no more gaining weight. She was actually losing. She was sleeping on her own. She was waking up refreshed. And that's what we do. This is what we work on with patients, is moving you from a point of pain and suffering to living a vital, healthy life. And this second patient, she came in with joint pain, depression, anxiety, heart palpitations, irregular cycles, and we found autoimmunity, we found inflammation, candida, blood sugar balance, and she chose not to get care. And I will tell you, there's always going to be something, and there is never a good time. But meaning that there's going to be a holiday, there's going to be travel, so she had a lot on her plate and decided to put it off. And a couple of years later, she came back, and she came back because now it was affecting the things that were really important to her. It went from she was suffering to now she was like limited in suffering. She wasn't able to travel like she loved to do. Her joint pain was affecting her every single day. And we tested her, and it wasn't one autoimmune marker, now it was 2. She didn't just have blood sugar imbalances, she was now diabetic, and her inflammation had increased, which puts her at risk categories of things like cardiovascular disease, stroke, Alzheimer's, dementia, cancer. And she did get care and she did get well, but I will never forget when she said to me, she said, my health is negatively affecting every single area of my life, and I can't get those 2 years back. So if you're on a train track and you're headed the wrong direction, when is the right time to get off of those tracks? The right time is to do something. Do something as soon as you know it's there. Ask somebody for help and work on getting to, again, the root cause of what you have going on. So in my office, conditions we help are vast and wide because we don't treat symptoms. We treat the body. So when you come in with symptoms, if we do need to use medications, we will. but we're going to do that at the same time, or we're going to try to avoid medications if at all possible, or get you off of medications by correcting where these things are coming from. So our first visit, we do a thorough consultation and a case review. This can be in person or virtual, so it doesn't matter where you live. We take care of people knee to knee in the Midwest, but virtually all over the country. So we always start with a full comprehensive functional blood panel that's going to be at least $399. It is over Blue Cross Blue Shield in Iowa. It's over $1,200 for this test. They will not pay for it because it's functional testing. They'll deny. So we were able to get a cash negotiated price to $399 because we are not submitting to insurance. So you get that discounted price. I know I have a friend in Michigan, and in Michigan, the insurance companies are charging over $3,000 for this test. So we look at over 70 different biomarkers. We look at, it's an autoimmune screening, nutritional status. We look at inflammation levels, cardiovascular disease risks. We look at 8 different thyroid markers. We do full metabolic immune function, CBCs with a differential. And you can do that in labs throughout the country. So there are some people that we need to do a few additional tests. Like if you are a male over 50, we'll probably run a PSA on you, but we always prostate specific antigen, but we always do these things at cost. And that's like $1,375 or something like that for the testing. You will not be surprised. You're going to know about this ahead of time. We will tell you exactly what we would test, why we would test it, and exactly what it would cost. If you decide to not do testing, that first consultation, the first one with us, is absolutely no charge, no risk, like I had talked about before. Now, second step, if we do move forward with testing, is to review those lab results with you. And we're going to let you know if we accept your case or if we feel like you should do something else. I mean, we're going to come up with a game plan no matter what, but we only accept patients that we feel that we can help, that you're a good candidate for care, and that you're ready to put in the work. I mean, this is something, there's no greater gain than gaining your health back, but it doesn't just happen without you putting a little bit of work in. We'll be with you every step of the way. Most people 2 weeks in tell me it's already easier than they thought it was going to be, but your health has to be your responsibility. We're a partner with you, if that makes sense. So we do sometimes do some secondary testing. If there's red flags in that first test, we might go, oh, we've got to dig a little bit deeper here. And those secondary tests are done at cost as well. We will outline the frequency, the length of care. We do customized plans. We do targeted nutraceuticals, vitamins, minerals, herbals, adaptogens, medical grade shakes. We don't just throw these at you and hope for the best. We are going to post test you at the end of that 4 to 6 month period of time. So we can look at befores, look at the afters. And in my office right now, there are 4 board certified functional medicine practitioners. We are much less doctor-patient, much more healthcare partner. You will have direct access to us as practitioners. So there's no, I can't ever talk to the practitioner that I'm working with. You're going to have direct access 24/7 if you need it. We really will be with you every step of the way. That initial intensive care plan with one-on-one consultations, the complete case review, personalized eating plan, patient binder, cookbook, journal, advanced testing, customized nutraceuticals, direct access. It can range. I don't know what you need, so I don't know exactly what it's going to cost, but I can promise you not one initial intensive care treatment plan here in my office in the last 20 years has lit a candle to what I paid for my daughter's dental work. So it will be an investment, but the best investment you can possibly make is in your health present and your health future. That's going to be something that's going to actually save you time, suffering, and money in the long run. So you've got to determine what you want to make your investment in. So sometimes I realize that asking for help can be hard, and I know that it can be scary, but and I also know that new information, even if it's valuable, it does not change your life. It's new decisions that change your life and action steps. So you have to be ready and willing to act on information right now, because it's going to become a bigger mountain to climb later on. So I know so many people, what kills me is that they're burning through time, just so much wasted time, because they're trying this and trying that and going to Dr. Google and trying to figure out what they need to do. This stuff is hard to figure out on your own, and it can really be laser beam focused when you bring on a practitioner that knows how to help you get on the other side of this. So I want you to ask yourself, like, where do you think you will be in 2 months? Like, where are you going to be in 2 years or 2 decades if nothing is done about your current health condition, or if you keep doing the same thing expecting a different result? So some of you recognize, I know that you know you need to do something different about your health with your life. I'm here for you. I know that this can be overwhelming, and sometimes the first step is the hardest, and I get that. But listen, you literally have nothing to lose by talking to somebody, and it doesn't have to be me. If you do want to do a consultation with a practitioner in our office, please, I ask you to be respectful of our time. We'll be respectful of your time. If you schedule that appointment, please show up early. Please be there. Please change that appointment time at least 48 hours in advance, because we oftentimes move on to a 5 to 6 week wait list with these consultations, and we have a limited number that we can do every single week. So reach out to us. We do live, breathe, and love helping people become, health warriors and feel empowered and excited to gain control over their health. And if you are somebody that you do want to consult with us, there's a couple of ways you could do that. You can go to Yost Wellness Center. Let me show you this. And on Yost Wellness Center, there is on the top, you can request a consultation, or if you want to grab an appointment time even faster, probably the fastest way is to just give us a call. So 515-278-4325. You can get a hold of us Mondays through Thursdays, leave a message on the weekends, and I promise you somebody from my office will get back to you. We'll take really good care of you, and together we'll get this figured out. Thanks for being here.